Good afternoon. Welcome back to Downing Street for the government's daily press conference on coronavirus. Today I'm joined by Lynn Owens, Director General of the National Crime Agency, and by Stephen Powis, National Medical Director of NHS England. The government's step-by-step plan has always been to slow the spread of this disease, increasing the capacity of our world-class hospitals so that they can cope. And your hard work has helped us to do this. Our instruction remains clear. People should stay at home, protect the NHS, and save lives. Through our ongoing monitoring and testing programme, as of 9 a.m. today, I can report that 640,792 tests of coronavirus have now been carried out in the UK, including 28,760 tests yesterday. 148,377 people have tested positive. That's an increase of 4,913 cases since yesterday. 16,411 people are currently in hospital with coronavirus in the UK, down from 17,049 yesterday. And sadly, of those in hospital with the virus, 20,319 have died. That's an increase of 813 fatalities since yesterday. As the deaths caused by this terrible virus pass another tragic and terrible milestone, the entire nation is grieving. My deepest sympathies and condolences go to those who have lost loved ones. And I would like to pay tribute to the selfless frontline workers who have been struck down by this virus. Their exceptional public service and sacrifice will not be forgotten. The last time I was here, I spoke about the impact of this national emergency on crime and the tough but necessary measures to tackle it. I announced enhanced support for victims of domestic abuse, many of whom are particularly vulnerable and exposed. Our You Are Not Alone campaign to signpost the help available and to make it clear to victims that they can still leave home has made an incredible impact, with 98 million online impressions. Now, I refuse to ignore the amplified risk for the victims of hidden crime, and I, along with Lynn and across our entire law enforcement agencies, refuse to allow criminals to take advantage of these unprecedented times. Now, provisional data from police shows a fall in overall crime during this coronavirus outbreak. Car crime, burglary, and shoplifting are all lower than the same period from this time last year. But we also know that the most sophisticated criminals continue to exploit and capitalise on this horrendous crisis. So today I have a message for them. Our world-class law enforcement is also adapting, and they are onto you. And their efforts are paying off. Last week, Border Force found £1 million worth of cocaine set to be smuggled into the United Kingdom through the Channel Tunnel, hidden in boxes of face masks. The National Crime Agency has taken down multiple websites running phishing scams and selling bogus PPE. Last week, they arrested 2 people suspected of trying to sell unregistered coronavirus testing kits. The NCA have alerted the police of 1,300 potential child sexual abuse cases. They have made arrests and safeguarded children. This is a sickening reminder of the frightening activity that is targeted towards our children every single day. International action to crush criminal gangs and to shut drug supply lines continues, and the National Crime Agency helped to seize 700 kilograms of heroin in Pakistan, potentially bound for the United Kingdom. Reported losses for coronavirus fraud now stands at £2.4 million. And I would like to thank the major banks and UK Finance who are working with us to protect vulnerable people from becoming victims of crime. And our outstanding frontline police officers and their staff continue to do an exceptional job in keeping our streets safe. They are still responding to all types of crime. That includes some extraordinary dangerous driving, with a minority of drivers using quieter roads as their own personal racetrack and endangering people's lives. We've seen speeds of up to 151 miles per hour clocked on the M1 and 134 miles per hour in a 40-mile-per-hour zone in London. Police and fire continue to put their arms around people and our communities by taking people shopping and taking prescriptions to the elderly, driving ambulances and supporting those in need throughout this difficult time. I'm immensely grateful to each and every one of our emergency service heroes. And I would also like to take this particular opportunity to pay tribute to the South Yorkshire Police motorcyclist tragically killed as he responded to an emergency earlier this week. My thoughts and prayers are with his family, friends, and colleagues at this truly heartbreaking time. His death shows how our exceptional police put their own lives at risk every day to protect the people that they serve. Coronavirus merely highlights the extent of their courage, their compassion, and their commitment. Police officers and staff continue to put themselves at risk to ensure that people follow the life-saving instruction to stay at home. Now, staying at home for almost 5 weeks has changed the way in which we are living our lives, and I know how tough this has been. Huge sacrifices have been made. Jobs have been lost. People's futures have been put on hold. Weddings have been cancelled. Families have been able to see one another. Every single person across our United Kingdom has given up a great deal. From the vulnerable, the elderly, those self-isolating alone, to the hundreds and thousands of small and medium-sized businesses, to the children and young people whose education has been put on hold. This extraordinary national effort has been quite remarkable, and I'm grateful to everybody for playing their part. But we should not lose sight of the fact that this country's efforts are working. So my thanks goes to the British people. You have fostered a spirit of national unity that is helping us to get through this challenging time. The action we are collectively taking is working, and your sacrifices are undoubtedly saving lives. We know that people are frustrated, but we are not out of danger yet. It is imperative that people continue to follow the rules designed to protect their families, their friends, and their loved ones. This will continue to save lives. We all want to return to living our lives as normally as possible, and of course, as soon and as safely as we can. And that is what the entire government is working towards. But the 5 tests we have laid out must be met before we can ease these life-saving restrictions. We must be sure that we can continue to protect the NHS, that there is a sustained and consistent fall in the daily rates of death, that the data shows the rate of infection decreases, that the operational challenges are met, and of course, that there is no risk of a second peak of infections. Until then, we all have a role to play in pulling our country out of this crisis. So I urge you all to stay strong and embrace that spirit of national unity by continuing to follow the advice, to stay at home, to protect the NHS and save lives. I will now ask Lynn Owens from the National Crime Agency to give an operational update. Thank you.
Thank you, Home Secretary. Criminals have adapted to our new situation, but law enforcement is adapting just as quickly. As the country pulls together, I want to explain what we are doing to keep you and the nation safe from serious and organised crime. This is clearly a new environment for all of us. Officers across policing are doing a fantastic job engaging with the public, in explaining and encouraging people to comply with the government guidelines to stay home, protect the NHS, and to save lives. It is proving effective in the vast majority of cases. But serious and organised criminals are looking to take advantage of these unprecedented times. It is showing them for what they really are: amoral, corrupt, and exploitative. We have not yet seen an increase in any form of serious and organised crime under COVID, but we have seen offenders continue to take every opportunity for their own gain. I want to assure you that the National Crime Agency, which is responsible for leading the UK's fight to cut serious and organised crime, is responding as quickly as ever to stop them, and so are our police, our border force, and other UK law enforcement colleagues. I want to thank all of these officers who are working tirelessly to protect the public. They are ensuring there is no safe space for criminals to operate in. So let me paint you a quick picture. We are protecting you from offenders who are trying to avoid the lockdown rules and carry on their illegal businesses. We remain unflagging in our work to recover illegal guns. In the last month, the NCA's work with police forces across the UK, including West Yorkshire, Bedfordshire, Thames Valley, Greater Manchester Police and Police Scotland, but others too, has led to 24 firearms being recovered. Working with UK police forces and the dedicated regional organised crime units and border force, we continue to prevent the corrosive harm to communities from the scourge of drugs. In the last month, UK law enforcement officers have seized over 360 kilos of Class A drugs. As one example, the British Transport Police have made 70 arrests of people suspected of involvement in so-called county lines drug dealing. In another example, working with the Metropolitan Police, we have seized 20 kilos of cocaine and £500,000. And only yesterday, working with Border Force and the Police Service of Northern Ireland, we seized 36 kilos of cocaine. But the supply of illegal drugs is a transnational business. So too is our law enforcement response. Internationally, in the last month, the NCA has contributed to the seizure of in excess of 1.7 tonnes of illicit drugs. We are working to protect vulnerable children in the UK and overseas. The Home Secretary has described some of the exceptional work we have undertaken in the past month together with our partners. Following an international investigation, we recently arrested a British man suspected of possessing indecent images of children who was attempting to re-enter the UK from the Philippines. We are working to protect the border. We know that our joint work, together with immigration enforcement, is helping our partners in France to bring people smugglers to justice. An increasing proportion of attempts to reach the UK by small boat are being thwarted on the French side, with at least 30 people having been convicted. We are protecting you from those that are preying on your fears and trying to take your money. In addition to work highlighted by the Home Secretary, we have 86 other instances where we are working alongside a range of regulatory bodies and Public Health England on fraud. We will take swift action against anyone unlawfully selling fake kits or PPE. For example, a man from West Sussex was recently arrested by City of London Police and charged after being caught making and selling COVID-19 treatment kits to people in the UK, the US and France. Online in the last month, the National Cyber Security Centre, together with ourselves and the City of London Police, have taken down more than 2,000 scams relating to coronavirus, including fake online shops, malware distribution sites, and phishing sites seeking personal information such as passwords or credit card details. The Home Secretary has highlighted the collective national effort to tackle coronavirus. But the public can help fight crime too. Indeed, we have an ask of you. Criminals will try and exploit this national crisis. We are not trying to scare people at a time where many of us are already anxious. But we do want you to be aware of the simple steps you can take to protect yourselves and your loved ones from harm online. Firstly, protect your children online. We have created a range of material that will help you to talk to them however young they are and without frightening them. It includes guidance on how to identify manipulative behaviour. You can find a step-by-step guide at thinkyouknow.co.uk. Secondly, stay safe online. The new Cyber Aware campaign sets out 6 top tips on how to protect yourself online. These include creating strong passwords using 3 random words, regularly updating your devices and turning on backup. More details are on the Cyber Aware website. Thirdly, look after your money. Fraudsters have targeted members of the public by phone, by text and by email. They have used the current situation to peddle fake testing kits and prescription drugs. We are asking you to be vigilant for these scams. Be even more cautious than usual if you are contacted by unknown numbers, and don't open suspicious emails or their attachments. The police and banks will never ask you to withdraw money or transfer it to a different account. If you believe you are a victim, please report it to your bank and action fraud immediately. While the national restrictions are in place and you are staying home to protect the NHS and save lives, we, the National Crime Agency, together with our law enforcement partners, are pursuing relentlessly the most harmful criminals, whoever and wherever they are, to keep you safe. And looking ahead, we will help ensure that the country's economic recovery is not subverted by organised crime. We will continue to protect the public to the very best of our collective ability. Thank you, Home Secretary.
Thank you, Lynn. Thanks very much. I'm now going to hand over to Stephen Powers.
The NHS has pulled out all the stops to manage the surge in patients with coronavirus, and our wonderful staff, of course, continue to work around the clock to do just that. And as a result, the NHS has not been overwhelmed, and we have at all times maintained the capacity needed to provide patients affected by this terrible virus with the treatment that they need. But today, we're reminding everyone that the NHS is also there to help if you have a condition that is not coronavirus. It's particularly important that if you have symptoms of an illness that might need urgent attention, sudden facial weakness that might be a stroke, chest pain that might be a heart attack, a sick child who's not improving, or perhaps a pregnant woman whose baby is moving less than usual, you should contact the NHS. Go online or call, but online first through 111 by contacting your GP first, of course, or in a real emergency, there's always 999. Those methods of contacting the NHS are still there. For many of these conditions, fast diagnosis and treatment is absolutely crucial. So it's really important not to delay. The NHS is still there for you. I want to go through some data that you will be very familiar with in a set of slides that you will have seen over the recent weeks and to update you on the current position. So the first slide shows transport use in the UK. And as we've often said, we continue to see reductions in public transport usage. And here we show transport in London on the tube, buses throughout the country, National Rail and Transport for London bus. And they are all at much lower levels than they were prior to the social distancing measures being introduced. We've seen a reduction in motor vehicles too, but there is maybe a little bit of concern that that is starting to rise again, ever so slowly, but that's really important that we think about that. And on the next slide, this is a new slide, which takes data from Apple Maps, from people seeking directions or asking for directions in Apple Maps, and I'm sure similar available will also be available from Google. This is a 7-day rolling average, and once again it shows a decrease since the lockdown measures were introduced of requests for walking, driving, or instructions on public transport. Now, of course, the sun is out around the country, the days are getting longer, and I'm sure it's tempting for people to feel that they should go out, particularly as I'll show you in the next few slides, when we are beginning to see the benefits of that social distancing. But of course, I can't emphasize enough that we are far from there yet. It's really critical that people maintain their compliance with those social distancing instructions. It won't take much for this virus to start increasing its transmission again and to spread more widely. And it would be foolish and not right if we lost the benefits that we have gained over the last 4 weeks, which I know have been hard for everybody. So it's really important that despite the weather, we stay at home, we keep to the guidelines that we've been issued with. And then on the next slide, as I've said, we are beginning to see sets of data which show the benefits of complying with those instructions. So firstly, tests, this shows a number of new cases by testing, is reasonably stable. And of course, we are expanding test capacity all the time. So we may see some more positive cases through that expanded testing capability. But this is a fairly stable set of data now. And on the next slide, we show people in hospital with COVID-19. And you can see now we are getting a sustained reduction in people who are being treated in our hospitals, particularly in London, where you will see a steady decline, but also you will start to see the beginnings of declines in other parts of the country as well. And then on the next slide, we focus specifically on those small number of patients who unfortunately have to be treated in our critical care facilities, our intensive treatment units and our high dependency units. And you can see again, we are beginning to see a decline, although that decline will lag the overall number of admissions in our hospitals. Now we have new data here for Northern Ireland, and you can see that in the light blue line. And we've put that in to present a truly UK-wide picture. But I should just note that this is new data and it's not currently comparable with the other lines, as it shows cumulative data rather than daily. And that's why the line looks a little bit different on this chart. And then on the next slide, finally, this is the number of deaths in UK hospital. We report hospital deaths on a daily basis. These are reported deaths rather than the day of death. And you can see again that there is a trend towards a decline in deaths. That is a trend that will occur later than the decline in hospital admissions and critical care. But it's really critical that if we keep complying with the social distancing instructions, then we will begin to see a decline in deaths.
Stephen, thank you very much.
Oh, sorry, there's one more slide, sorry. There is one more slide, which is the global death, sorry, Home Secretary, global death comparison, which again, we show, and again, this shows UK hospitals only, but also with a lag on it, it also shows deaths in UK in all settings. So this includes deaths out of hospital, but as we've said on a number of occasions, there is more of a lag in the collection of that data. We're improving that, but there is a lag, so that is shown a little bit behind the hospital-only death reporting. Sorry, thank you.
That's great, Stephen. Thank you very much, as ever. I'm going to hand over now to questions. First question is from Lauren Moss from the BBC. Lauren, good afternoon.
Thank you, Home Secretary. Good afternoon. On the 28th of March, Professor Powis, you said we will have done very well if fewer than 20,000 people died during this epidemic, and we have sadly passed that number now. Does this mean the strategy should have been different?
So it's a very sad day for the nation. 20,000 deaths is clearly 20,000 deaths too many. And I think we should all recognise that our hearts, my heart goes out, so everybody's heart goes out to the families who have lost a loved one, the families and friends of those loved ones. When Sir Patrick Vallance and I made that comment a number of weeks ago, what we were emphasising was that this is a new virus, a global pandemic, a once-in-a-century global health crisis. And this was going to be a huge challenge, not just for the UK, but for every country. And I think, unfortunately, we have seen that challenge, not just here, but around the globe. And even in countries that have got on top of this early on, we are unfortunately beginning to see new infections. So I think the first thing to emphasise is that this, unfortunately, is not going to be something that we will get over in the next few weeks. This is something that we are going to continue to have to work our way through over the months ahead. As I've said before, this is not a sprint, this will be a marathon in dealing with this virus. And I think the moving past 20,000 deaths just reminds everybody what I was just saying when I introduced the slides, that it is still absolutely critical that we continue to follow the social distancing guidelines, because we are seeing the benefit of following those guidelines. And we will only continue to see the benefit, and we will only continue to see reductions in deaths if we all continue to do that.
Thank you, Stephen. Lauren, just on that point as well, I think, look, the nation today will be deeply moved by the figures of the number of people who've died. I mean, every death is a tragedy, but there is a very strong message here. Stephen has articulated this, and to viewers at home as well. we've made a great deal of progress, but actually we're not out of the woods yet. We really are not. And there is a lot more that we can all do as responsible individuals in the way in which we follow these measures. And at the end of the day, the message could not be clearer in terms of protecting the capacity of the NHS, making sure that people protect themselves through the measures that have been outlined, social distancing, hygiene, etc., etc. But I think right now, I think for the nation in particular, this is a deeply tragic and moving moment. All our thoughts and sympathies are with those individuals that have lost family members through this horrendous and absolutely appalling virus. Was there anything else you wanted to add at all?
Yes, please. But with that in mind and with this rising death toll, are there any circumstances now in which you would be able to envisage relaxing any of the measures of the lockdown at all?
Well, I think if I may, Lauren, on this, the government has been abundantly clear in terms of the things, in fact, I outlined that in my remarks earlier on, about the 5 specific things that have to be satisfied. This isn't optional at all. They have to be met. Those tests have to be met so that we can judge with the scientific advice and the advisors as to when we will consider it to be safe to adjust the current measures. And quite frankly, that is not right now. It is clear that it is not right now. And as I've said, as Stephen has said, as Lynn has said, we've all said here today unequivocally, we need people to continue. The national effort has been extraordinary, it really has. I pay tribute to everybody. Our lives have changed in the way in which we function on a daily basis. You know, whether it's from our children, our households, our family, even the way those of us that are going into work every day. So those 5 tests are absolutely vital. We have to meet them before we can make any changes whatsoever. So we are very conscious of that. We have obviously had a really devastating moment in terms of the number of people who have died. We're fighting this virus, and that is the national effort that we're all behind. We're all putting our shoulder to the wheel to make sure that we fight that virus so that we can get the right outcome in the long term, which is combating this and protecting the public and saving lives. Thank you, Lauren. I'll now hand over to Paul Brand from ITV. Paul, good afternoon.
Thank you very much. Firstly, to the medical director, the 20,000 figure refers, of course, to deaths in hospitals, and you've said that there's a downward trend in that number. When do you expect the peak to come in care homes specifically? And to the Home Secretary, please. Doctors and nurses who come to the UK to work in the healthcare sector have to pay a health surcharge of hundreds, even thousands of pounds for their families. Given that they too are fighting this pandemic, is now the right time to scrap that surcharge for them?
Thank you, Paul. Stephen, what do you
Yes,
think?
I think all along we've resisted trying to predict when peaks occur because it's always difficult in advance. You can do that by looking backwards. I think the point about care homes is a really important point, though. And we know there are outbreaks in care homes, and we know that it's really important, obviously, for the residents and staff of those care homes and their loved ones, that they are dealt with swiftly and they are dealt with correctly. So Public Health England and others are assisting when outbreaks occur. The government is increasing testing, PHE are increasing testing in those care homes, which will be a very important part of getting on top of infections in care homes. And of course, the staff in those care homes again are working round the clock. I paid tribute to NHS staff earlier, but I'd also like to pay tribute to the many staff and carers in care homes and also caring for people at home in social care as well, because they are working just as hard to ensure that we get on top of this virus.
Thanks, Stephen. And Paul, in response to your question, well, first of all, everybody that's working in the NHS in the front line, who are working night and day, clearly are making just an extraordinary contribution at this particular time. Paul, you'll be aware of many of the changes that we've already made around the immigration status, the visa status for NHS workers, extending their visas already if they were coming up for expiry, and we're providing a great deal of support on that basis. I'll be very clear. We have a range of measures that are, like most things in government, under review. And we're looking at everything, including visas, surcharge, and that is something that obviously I'm working with my colleague, Matt Hancock, in the Department of Health and Social Care, because that's a joint policy with Matt's team. And we're looking at everything now in terms of what we can do to absolutely continue to support everyone on the front line in the NHS. We are speaking about the healthcare professionals, the medics, the doctors, the nurses, the allied healthcare professionals who have come to the UK and are making an immense contribution. Was there another point that you'd like to raise?
Yeah, if I could please, just to Stephen Powis again. I appreciate it's difficult sometimes to get the data on the care sector, but many in the care sector are telling us they do feel as if they're dealing with this crisis blind because they're not being given a sense of how the virus is spreading across the sector. Is there anything you can tell us about the way the virus is spreading, the likely impact on the care sector, when you think the peak might come, and how many people may end up sadly losing their lives in that sector?
So I think, as I said, I know that Public Health England are stepping up their support for the care home sector. And I know increasing testing, not just of people in care homes who are symptomatic, but increasingly of others as well, is going to be a really important method and way of ensuring that as we get as quickly as possible on top of those outbreaks in care homes. So it's something that as a group of clinicians within government, within PHE and within the NHS, we care very much and worry very much about the care home sector, and we are increasing the support that goes into managing the virus in care homes in particular.
Paul, many thanks. I'm now going to move on to Lisa Holland from Sky News. Lisa, good afternoon.
Hello, good afternoon. This is a question for the Home Secretary. We saw there that motor vehicles are starting to rise and that you had said that that was a cause for concern. Sky News has spoken to Professor Susan Mitchie, a member of SAGE's Behavioural Advisory Group, who says that the government is sending out mixed messages. On the one hand, telling people to stay at home, and on the other, allowing non-essential work to take place. So what would you say to that? And Professor Powis, what would you say to people who are struggling to understand that if they've been in complete lockdown for over a month, they've absolutely played it to the letter, followed all the rules, and they have a loved one who has done exactly the same, why they can't extend their household into a smaller group, if you like, rather than just the people living under the same roof?
Well, Lisa, let me start by answering your point and question that has been raised about transport and messages. The government's message has been clear and consistent from day one about staying at home, obviously to protect the NHS and to save lives. But we've also been clear about people going to work, that if you can't work from home through social distancing, the measures that are actually in place in some workplaces now, that you can go to work. But I do want to say something else around this. You have highlighted, in fact, Stephen has highlighted as well, from the very first graph that was put on the screen, that we are seeing an increase in the number of journeys that are being taken, more people being out and about. We understand the frustration. Of course, we understand the frustration. People have been at home for 5 weeks. However, if we're going to combat this virus and to save lives, we want to stop the spread of this virus. We have enforcement measures through policing. Those enforcement measures are being applied, they are working, and we've been very, very clear about that from a policing perspective as well. And I have seen, and I speak to officers, police officers every single day, everyone from law enforcement, chief constables, across the policing family, who have officers out and about in our communities. They're engaging, they're explaining what the guidance is, why people must stay at home, why social distancing matters now, and social distancing will continue to matter in the future. We've got no doubt about that. That is what is stopping the spread of the virus. And that is effectively what we are trying to do. So there are no mixed messages. We have been clear. The police have been clear. Law enforcement has been clear. I think throughout, every single aspect of government communications and the practices that we are encouraging and in some quarters enforcing in society through the police, staying at home and enforcing social distancing is absolutely vital. And that is the message for viewers today as well. We're seeing that uptick in transport. We say again to the British public, we need you to continue to follow those social distancing measures and stay at home to protect lives. Stephen.
So I know absolutely how difficult it is, particularly for those who want to visit loved ones, extended households, extended relatives. But I think it's important to remember that one of the main ways that this virus is spread and transmitted is from household to household. And so the very basis of the social distancing measures that were put in a number of weeks ago was to interrupt that chain of spread from household to household. And I think we have seen that that and the other measures are working. We've shown that in the data we've shown today and on other days. And I think the British public have done fantastically well to keep complying with those measures and to break those chains of transmission. But I think we would all be disappointed if we forfeited those gains by releasing too early and by allowing those chains of transmission from household to household to start to be re-established, because then we would start going backwards. Then the virus would start to transmit and spread more, and those downward curves that we're seeing would unfortunately start to rise again. So it's too early yet. We need to be confident, as in the 5 tests the government have set, that we are really on top of this virus before we proceed to the next phase.
Thanks, Stephen. Lisa, was there anything else you wanted to add?
Yeah, just to say that you say there are no mixed messages, but isn't opening a DIY shop a mixed message?
Well, shops are open. We've seen supermarkets open and they're all practicing social distancing. And they've been doing that incredibly well, I should add. I think, again, the British public have adopted that incredibly well. We've also been clear that if you can work, that you should be able to work, and that is down to employers following social distancing measures and practices. And effectively, that's what we are asking the British public to follow, those particular practices and measures. They are restrictive. But with that, the public know why they're restrictive as well. So if I may say so, I think the government has been very clear in the stance that it's taken and in the communications and messaging. I think it's quite remarkable, whether you go to the supermarkets or even out on a walk in parks, the way in which the public are conducting themselves is very much in tune with that social distancing policy and the advice that has been coming from the scientists and from medical officers and from the government. And I pay tribute to the British public for following that. Thank you, Lisa. I'll now go to Nigel Nelson from the Sunday Mirror. Nigel, good afternoon.
No, it's one for the Home Secretary. The Royal College of Surgeons has told us that the backlog of cancelled operations could take 5 years to clear. Is that the timescale that you're now working on? And how many lives do you estimate that these delays will cost? And one, if I may, for Stephen Powis. When Dominic Cummings attended its Sage, did he ever say anything? And if so, what?
Well, Nigel, let me start. I think very much to your point and your comments and reflections from the Royal College of Surgeons. As ever, Department of Health, Social Care will work with the NHS, with NHS England, and advisors in terms of care, elective care, surgeries, addressing many of those issues that you've highlighted, and of course of enormous concern to individuals who are perhaps potentially waiting for operations. We want to make sure, of course, that services resume in the right and proper way. But while this virus is on, obviously within the NHS, and perhaps Stephen could expand upon this too, there are certain ways of working across the NHS, certain prioritizations of cases of surgery and the treatment of patients. And of course, those decisions will be based on making sure the NHS is adequately resourced, has the capacity, but also is able to cope with the virus and contain the spread of the virus within a medical facility. Stephen.
Yeah, so we work very closely with the Royal College of Surgeons, and neither the Royal College or ourselves in the NHS would want to see delays of that order of magnitude. We have had to step down elective surgery in order to focus on ensuring that we cope with the surge in patients with coronavirus. But as soon as we possibly can, we do want to step that back up again. I think the Chief Medical Officer has on a number of occasions articulated the consequences of a global pandemic in terms of deaths and harm to individuals and populations. There are the deaths that occur directly as a result of the coronavirus. We've talked about that sadly earlier. There are the deaths and the harm that occurs because a health service becomes overwhelmed and simply can't cope. And we haven't seen that here. As I said earlier, the NHS has coped admirably, and we've always maintained the capacity that it hasn't been overwhelmed. We can also see deaths and harm because individuals, for whatever reason, don't access the services that are actually up and running. And that's exactly why I opened today with a reminder to everybody that those emergency services are still there for you. And you mustn't be afraid to come forward and to access them, and certainly not to delay accessing them if you have symptoms that might be an emergency. And then finally, there's the harm that is potentially done because of the economic consequences of a pandemic. And it will take many years to see exactly what those consequences are in terms of harm to the population. But in the third of those, we do want to get those services, those elective services, up and running as quickly as we can. We are beginning to focus on that in the NHS now, but clearly we need to make sure that we are also managing the patients that we still have with coronavirus. On the question on SAGE, I've been attending SAGE since towards the end of February, and my experience of SAGE has absolutely been about scientists and experts, and there are scientific experts at SAGE from a variety of disciplines, epidemiologists, behavioural scientists, public health officials, immunologists, from the wide range of expertise that you would need to manage this crisis. And at SAGE, it is a scientific discussion. What I've witnessed and experienced is a scientific discussion between scientific advisors, robust discussion at time, as we consider the evidence, conclude what the evidence is telling us, sometimes point to where the evidence is missing and where we need to gain and generate further evidence, and then, as is in the name of the group, then to provide advice to government and government officials in terms of the scientific basis of the choices that government quite rightly has to make as elected representatives.
Thank you, Stephen. Nigel, was there anything else you'd like to raise at all?
Just whether or not that Dominic Cummings actually made any contribution at those meetings.
Well, the scientific contributions are exactly as I said. It's the scientists that make the scientific contributions, and the scientists and the experts in that group that are absolutely involved in generating the advice. So the advice comes from those scientific experts to government and government officials. That's exactly what SAGE is set up to do, and that is exactly what my experience is of the way SAGE works.
Thank you, Stephen. Nigel, many thanks. I'm now going to hand over to Brendan Carlin from the Mail on Sunday. Brendan, good afternoon.
Good afternoon, Home Secretary. You've stressed today sacrifices made by the British public. You've paid tribute to them. One of the biggest sacrifices is possibly the fact that the schools are closed. Do you not sympathise with parents up and down the country who are having to juggle between childcare and the need to get back to work and help restart the economy as soon as possible?
Brendan, of course. I think, you know, as a parent myself, and all parents working from home, and particularly with children who may be engaging in the homeschooling as well, that's taking place, this is immensely difficult, and it's an immensely challenging time. I pointed that out in my opening remarks. These are very, very difficult and unusual times. I have to say, I think schools that have opened have been brilliant. They've been absolutely remarkable. I pay tribute to many of the teachers and the head teachers. I know from my own constituency some outstanding examples of teachers and people in the teaching profession. They're doing a great deal to help, you know, support the children of key workers, but also vulnerable children right now as well, and we should not forget about them. The fact of the matter is, Brendan, I've already outlined the 5 tests that will have to be met, absolutely, before we can look at restarting schools. And I think the key thing to note that is, before we can even do that, those tests have to be made. We want to do this in the right and proper way. We need the scientific and the medical advice to come together in the right kind of way. And I think both parents, teachers and children would welcome that on the basis that they want to know that they're going back to school at the right time, in the right way, with the right kind of support. And that is absolutely what this government is working towards achieving. Did you have another question at all?
Yeah, could I just come back on that? You've not really given much of an assurance that today, in the general tenor of the press conference, that any active planning is underway for how we restart the economy. And again, in relation to schools, we know, and I think teaching unions have been making this clear to ministers, that safety is paramount about how we come back. But can you give parents any sort of assurance today that there is any active consideration, I mean serious detailed consideration, of when we come back to schools? And just one question, if I may, to Professor Prowis. At the beginning of this process, there was much debate about the time that we entered the lockdown in terms of making sure that everything was that people would accept and live with it. If it appears to be something that may have to go on and on and on and on, what was the point of delaying the point we entered it?
Well, Brendan, first of all, let me come back to your question. We can absolutely give a clear assurance to the British public. Government is working night and day on looking at how we can move us out of this situation. I touched on this in my remarks as well. We understand the difficulties, we understand the frustration, but this is not a binary choice. We cannot move from, removing restrictions in terms of just moving back to how things were. It is right that we consider the advice, and we are doing that. We're absolutely doing that. We're working with our advisors, with SAGE and others, but as you all know as well, and as you're seeing, we're working with others, we're listening to others from business, from industry, as to how we can move forward. But the fact of the matter is, we want to prevent a second wave of this horrendous virus. And to do that, we have to make sure that we continue with the measures that we put in place, but also to move to any form of changes, whether it's schools, whether it's business, whether it's restarting aspects of society. We need to make sure that we have the right kind of preventative measures in place to stop another wave of that virus. The British public would look to their government to make sure that their health, their safety, their well-being is absolutely paramount, along with the health, the safety, the well-being of the NHS, protecting that capacity. That's something we have been consistently doing, and we continue to work towards achieving that. And I know you'd love me to give you a date as to when schools may reopen, but we're not going to do that. That would be irresponsible to do that. That would set hopes up. The fact of the matter is, we are all, as you've heard me say, we're putting our shoulder to the wheel to work night and day to look at how we can do things differently and in the right way going forward. And that's what this government is committed to doing. Stephen.
So timings of lockdowns at whatever point in a pandemic, and timings of the individual measures in a lockdown, I think are really difficult decisions. And I talked a little bit earlier about the harm and deaths that occur from a pandemic, and I said some of those are relating to the health service and health services being overwhelmed or having to stop some activity in order to manage the virus. And I talked about the harm that potentially comes from an economic lockdown. And as the Chief Medical Officer has said a number of times, it's not always possible to manage those in the same direction at the same time. So there are a set of choices, difficult choices to be made in pandemics. And that's why deciding the timing around lockdown measures and the combination of lockdown measures is a challenging thing to have to do.
Stephen, thank you. Brendan, thanks very much. I'm going to bring this to a close now, but before I do, I want to thank both Stephen and Lynn, as ever, for their valuable insights and contributions. But I do have a final message to send. I've been here with Lynn today, who has shown the stellar work of the National Crime Agency. And I say again, to any criminals seeking to exploit this virus for their own gain, our outstanding police and law enforcement agencies are absolutely onto you. They are the absolute best of us all, and they continue to work tirelessly to keep our country safe. And then finally, to the British people, I want to thank you, and I urge you, as ever, to back and to continue to back the extraordinary national effort to beat this virus, to stay strong, and to follow the advice, the consistent message we have been given, to stay at home, to protect the NHS, to save lives. Thank you very much.